Happy Thursday and welcome back to school. Relatively school. I just miss you guys so much. I cannot express to you as a teacher how hard this is when this is your passion and you can't go do it with the people that you care about and love, that you've got to do it from your own house by yourself, and it's not nearly as fulfilling. But I just want you to know that I'm totally here for you. Feel free to drop into office hours. Those are going to be set up now with Zoom, and I'll just be in there waiting. And if anybody wants to come chat or get help, I'll be there. So please take advantage of office hours. They're at 2:30 to 3:30 every day. So I will be there. Going forward too, we're going to try to do more actual classes where I will teach something, and what I'm going to do is I'll probably teach something, record a video on it, and then we'll have a discussion, okay? So today, I'm going to give you an option. I wanted to kind of catch everybody up on where we were and just touch base again. I just miss you. I want to hear how things are. I want to hear how you're feeling. I want to hear how this is impacting you. I want to make sure we're catching anything, if we can help each other out, if there's something we could offer each other. So today, what you're going to do is I'm going to do this little brief demo lesson here. I'm going to talk to you about what's going on, update you on the pandemic, and then today your job is to write a response to that. Now, you can do that two ways. You can physically write a response, so type it or handwrite it and send it to me, and that's your assignment and you're done. Or after you watch this video, then this afternoon, I'm going to be having 2 sessions where you can meet up with me and have a discussion about this. And if you choose to come have a discussion about it and at least make a comment, then you will get credit for today's assignment. So either handwrite a response or get on with me today in the afternoon during one of the 2 sessions and look on Google Classroom for when those are going to be. But get on and join us in discussion, okay? We'll be doing that through Zoom. So just wanted to kind of update you on what's up. The district's asking us to use certain platforms. So I know a lot of you have great ideas about what we could do, but this is what we're going to work with right now. And maybe that will change as the month goes on. But that's where we are. I miss you so much. I cannot express to you, seriously, that we're not going to come back together. And there will be a day for sure when they have locker clean out, or a few days where they stagger it. So that will happen. So maybe we can wave goodbye for the summer from a distance. But I wanted to talk a little bit this morning about what they're finding out and why the social distancing is still so important, and why a few weeks wasn't going to work, and to be real with you, why we're going to need more than a few more weeks. I'm really thinking that this will probably be our reality through July. And I know that sucks. It kind of freaked me out yesterday when I really started looking at numbers and doing some research. I was like, we're not getting out of this anytime soon. And that's really hard to hear. I know how hard that is. I can't imagine being a teenager right now and going through all of this and being stuck in my house. And you know, this is the time when your whole entire being is like freedom, and then this is changing it. I feel bad for all these seniors that they are not getting to finish the year the way they wanted. Like, all of this is just weighing on my heart. I know some of you are in tough places, and this has been even more of a struggle, and I just want you to know that I echo that, I hear that, I feel that, and I'm here. So please check in, come to office hours, call me, whatever, email me. I'm here to listen, okay? So let's get started. I want to just give you some facts and go back to my numbers, okay? So before we left for break, right? Let me put this a little higher. Before we left for break, our numbers were here. Now, I added a little bit, but we were at March 26th. So in the U.S., it was at 85,377 with 1,200 deaths. And then over here, we were at 531,000. We were at 500,000 before we left for break. And then I kept track a little bit during break. I tried to actually distance myself from that a little bit to not really freak myself out. But like, deaths were doubling every couple of days. And that's hard to take in the U.S. And of course, these numbers jumped quickly. We got to 1 million on April 4th, and it's just pretty crazy. So now let me give you where we were at today, and I looked these numbers up last night, so they might be more this morning, obviously. Okay, so we are at, in the world, 1,518,970. That is a million, basically a million more than we went to break a week ago. A million more since we went to break. And we are at 88,000 deaths. Okay, and I'll show you these numbers again in a second. We are at 435,000 cases in the United States, and we are at 14,000 deaths. So we were at 1,200 deaths when we left for break, and now we're at 14,000 deaths. So you basically have 12,000 people in the course of spring break who have passed away from corona in the United States. I'm just being real. When we're talking about social distancing, this is not a game. I don't put these numbers up here lightly. I know that some of you have already had some family members, not immediate family, I hope, but I know some of you have extended family that is already in the hospital or has had other complications. And so I understand how freaking real this is. Not a game. I totally get it. I'm scared too. It's intense for me too. So I don't want you to take it lightly. I don't want you to think I'm taking it lightly, because I'm truly, truly, truly not. Okay? All right. So let me put this numbers down for a minute. And move this. Give me 1 second. Okay, so let's just put this back up here for a second. Let me turn this light off so we can get, there's no glare on it. Okay, so actually I don't know if that helps. Maybe it does help. Okay, so before break the cases were 85,377, and this was in the United States. Sorry, I just took that off of there. And the deaths were 1,295. So that was before break. And now here's where we're at. Cases have gone from 85,000 to 435,000 over the course of spring break. And deaths in the U.S. have gone from 1,295 to 14,795. So again, this was the world before break. And then here we are at the world now. We were at 30,000 deaths for the world. Now we're at 88,000 deaths. And that is climbing quickly. We were jumping about 30,000 cases there for a bit, like our 32,000, 20,000 cases every day in the world. It was jumping really fast. So good news, though, social distancing is working. So all this effort you've put into being stuck at home, it is actually working. So don't freak out. It is going well. We are getting there slowly. And let me just adjust this a little bit here. And the really good news is that the Bay Area is doing the best job so far on actually flattening this curve. So we are doing the best job so far. Hold on, I still didn't quite get it. You guys are probably like this, Rickard. Okay, anyway. So we're doing the best job in flattening the curve and reducing movement, which is making that count lower. But don't stop, right? This key part here, don't stop. If we stop and we give up and we go, okay, cool, it worked, let's go back to, no. No. Have not reached the top of this yet for our state by far. New York is not even sure they're at the top of the, curve. If it goes up, like, they're not sure where they are. So we're not remotely near that, okay? Hopefully we don't really get a big curve. But the point is, it is working. We are doing the best job in the entire country. The Bay Area is doing the best job. So I just want to encourage you with that. It's really important that you understand that the social distancing is working. We have to keep up that social distancing. It's not really, there's not an option, okay? And it's honestly the number one thing that's going to keep us healthy. Okay, so a few things to know. We are still about 12 to 16 months away from a vaccine. There are multiple drugs right now in human trials, so they are working on that, but they're not a cure. These treatments are not going to be a cure. Okay, there's no cure for a virus in history. You can only with prevention and a vaccine. That's how you do it. Okay, so we're really not there yet. Let me fix this. I know it's going to drive some people crazy. And so we really still have to be careful because we don't have that vaccine yet, okay? So how are we going to do this? We basically have to have two things. We have to have a vaccine and add to that herd immunity. And herd immunity means lots of us have basically either had it or have the vaccine. And once we've got that immunity, then it won't be as much of a big deal. A few people will still be getting sick, but it won't be on this level that we have right now, okay? But we are not anywhere near that. And that may take until August, September, October. I mean, really, some projections say December before we really start to see an end to this pandemic, okay? And the fear is this. If we come back out quick and we're like, okay, great, everything's open again, like, to start up again, and we all go back to school and we all do all this, it's going to actually jump again. So we're flattening it, but as soon as we come out of this, we're going to make it jump again. So we have to really wait until these things are really in place on some level. Either this is happening a lot or this is starting to happen. Either way, it's going to take us a while to get everybody vaccinated, but that's how we get to the end of this, okay? They are using blood of the people of survivors, so people who've actually gotten past COVID, their blood has something special, because if you remember back when I talked about viruses and how the immune system works, the immune system comes in, fights in your body, finds out what's wrong, and attacks it, and then creates an immunity against that, right? So what our cells have to do is have time to do that. Well, these people have survived. Their cells have already figured out how to make an immunity to this. They've already figured out how to fight against it. So if you take the blood of those people and you can give that plasma in treatments to the people who are sick, it can actually boost their body. It'd be like if you have a cheat sheet, you give me the cheat sheet, now I can cheat. So it's going to help those people perhaps to find a way using antibodies, meaning that your body has figured out a way to fight off that disease. We need those antibodies to now go to somebody else's body and do it faster, so their body doesn't have to fight off COVID as long, right? And so that will boost the immune system, and then they're able to fight it. So there is lots happening, but we are still seriously months away from a vaccine. Treatments are another thing, right? There are treatments that they're trying to do, but there are some pretty crazy stuff happening behind that, and I'm trying to figure out a way to approach that, so I'm going to wait on that. Maybe that'll be a conversation we have on Zoom, but I just want you to know they are working on it, okay? So since we are this cure, you're like, well, where is it? Well, we're still that 12 to 16 months away, right? I think I copied this already. I did, right? Okay. But I didn't get this part. The virus has a fatty outside cellular envelope or wall, okay? And that is protecting it longer. So it can even live in the freezer or the fridge. So this fatty outside layer on this virus makes it harder to break down than some other viruses, okay? So which is why it's more contagious, why it's lasting longer, why washing our hands and all that becomes even more important, because that virus is lasting longer than it should normally. So normally viruses will die within a few hours on something, but that's not the case with this virus because it has a kind of extra protection. And so you have to get through that protection, okay? That's why this virus is tricky. So some changes that you really need to know. One, they're finding out that more young people are getting severe cases of this as it moves across the country. That might just be a mutation in it. It could just be the way the virus is impacting people. But they are starting to see that younger people are actually needing to be put on ventilators. So I want you to get out of that mindset, well, I'm young, I can't catch it. Less likely, but I'm telling you right now, they're already seeing changes in that. So I need you to be super, super careful. It's not just about protecting those people that are older or at risk. It's also about protecting you. So seriously, do not let up on this. We have to stay at the social distancing thing, okay? So how's this virus killed? Good question. Okay, so a few things. So one, 70% or higher alcohol solution and alcohol products. Now hold up, not drinking. I'm talking about alcohol, meaning rubbing alcohol. So like, hold on one second. So we're talking about rubbing alcohol, right? And I just want to show you this. This is what we're talking about, right? We're talking about rubbing alcohol, and this alcohol, right, is what is killing that virus because it breaks down that fatty layer. Okay, so it is one thing that breaks it down. I've even just like had this in the car, and I'm putting it on my hands. Like, if you're out of all the hand sanitizer, you're out of all other stuff, this is great. This is why. This is what's in hand sanitizer. So that's why hand sanitizer works. Okay. Also, though, just so you understand, you don't even have to have fancy products. So, really, what can do great with this is that it's killed very easily with soap and water and scrubbing. It breaks down that fatty virus. The way soap works is that it attaches to the oils and kind of envelops that oil and then can break it apart. So if you are washing really well with soap and water, and I mean you're rubbing your hands, you're really doing this, you're scraping your nails like this, right? Like I want to make sure you understand how you've got to like scrub it. You're scrubbing your knuckles, right? You're really rubbing your hands. You're doing it all over like this. You're getting your wrists even, like all this. You're really scrubbing, okay? It can't just be like, I did it. You really got to wash your hands. Then if you're doing that with soap and water and scrubbing, it's going to break down that fatty virus. You're taking the soap and you're scrubbing it on the counter. It's going to break down that virus. You have a package and you wipe it down with soap and water and like you're rubbing it. It's going to break it down, okay? So they're saying even if you bring something home from the grocery store, like let's say it's in a plastic container, if I wash that all off with soap and water, that's great because what we need to do is break down that virus. That's how it works, okay? So it seems to also not be doing well in the heat. So they're saying that some places it doesn't seem to be as existing as well because it's hotter. But there's still infections in some of those places. So don't get excited and go, oh, okay, cool. Like, I guess we don't need to worry about that. No, there's still cases in hotter areas. So I don't want you to, don't confuse that. Doctors are recommending you wipe down groceries and products brought in the house now because they're finding that it does live longer. It is showing that it can be spread from those who show no symptoms. That was the biggest shift. And so even in air or even in speaking and breathing, right, that virus can travel. So you're staying 6 feet apart and you're covering your face. The face is important. You've got to cover that face and stay 6 feet apart, okay? So if people want to learn how to make a mask, maybe I'll do a little thing about that later. I did make some so that I could wear them and I could be safe, but you need something that's actually going to cover your mouth and your nose. I see people wearing masks here, but this is not stop it. Or they've got them up here, but then the mouth is like around my neck. My neck is not where I'm getting infected, so it's about wearing that mask. And then it's about not touching that 100 times. So I see people at the store and they're like pulling it off and pulling it off, and they're touching things on the counter and then pulling the mask off. You're touching all that stuff, and then you're touching your face mask. Now it's on that mask. Like you really, people have to think this out. Okay. Also, if you have gloves and you're going around the store and you're touching everything, and then you get in your car and you go to the next place, and then you get a grocery cart and you touch everything, your hands become the same as those gloves. So you're not doing anything. It's one pair of gloves to do this. Then I take those gloves off. I throw them in the trash because a lot of people are polluting big time. Gloves everywhere in the parking lots. Like you've really got to like think this out. Let's be smart about how we're doing this and really think out how viruses act and travel and not be silly about it, okay? But there are also some big ways that this pandemic is pulling back the covering on the real story in America. And socially and with economics, this virus is revealing some things. And this is what I really wanted to talk about today, besides giving you an update, is the things that it's pulling back and showing us. And this happens in pandemics. You have a pandemic and things are going to rear their heads. People are going to have to see. Okay, right now, if you are able to learn and have access to a computer, and you have access to a school that has Chromebooks, and you have access to teachers who want to teach, and you have all these things, then those people are getting a better chance at education right now. there are school districts where we couldn't give kids Chromebooks. And if you don't have a Chromebook still, let us know and we'll get you one. But the thing is, our school was able to do that, right? And that was a blessing. But not all schools are able to do that. There are places where they don't have computers. They don't have access to that. So they just had to stop. So it's showing our privilege immediately. Our privilege is starting to show, and I need you to understand that, okay? All right, so here's what's happening. What all of America is basically waking up to right now is that the data shows that counties, not countries, counties where the majority of people are black or brown, there is 3 times the rate of infections and 6 times the rate of deaths. Okay, now, it's not that the virus is racist. It's not that the virus has chosen to attack certain groups of people. But the problem is that what America doesn't want to admit to, or what we don't want to face, and this has been the case for a long time. So it has been the case with lots of pandemics before this. It's not new. But the thing is, we don't realize that all poverty or even racism becomes an underlying condition that causes more things to happen. So when there's a pandemic, if you have systematically been oppressed, there is going to be a greater impact on you because that systematic oppression has left spots that are weakened for a virus pandemic to really attack in a different way, okay? And that's basically economically, and that's also even health-wise because it becomes this underlying conditions that weaken the immune system for you to be open up to being more susceptible to COVID. Well, not more susceptible, but more susceptible to dying from COVID. Okay, so underlying conditions are often the result of 1, lack of access to healthy food. So if I'm eating all the garbage all the time and I've got a high rate of diabetes in my community, or there's not a lot of fresh food, right? We've talked about this sometimes where on these street corners in poor neighborhoods, there's liquor stores and fast food stuff, but there's not healthy options. And so because of that, you really have a higher rate of diabetes, a higher rate of heart disease, a higher rate of obesity, a higher rate of all these underlying conditions that then give me a higher risk of dying of COVID if I do get sick. So that is a big issue. Now, we haven't wanted to address that. So because we haven't addressed that, that's an underlying condition now that is causing more deaths. And until our country wakes up and goes, look, man, we've screwed people over, we're continuing this process, and in a pandemic this really starts to show, we're going to have to really think about it. Because we're not going to get anywhere. And that's the same thing that happened with Hurricane Katrina, for example. All the people that were standing on the roof of those houses that couldn't leave, didn't have money to leave in a massive hurricane because they didn't have money to fill their cars with gas. It was right before the end of the month, so they hadn't gotten their paychecks from the government. All that stuff matters, and in a pandemic, it matters too, right? Okay, so there's also a lack of access to healthcare. If I am been systematically oppressed and I don't have as much wealth, then I don't have as much access to healthcare. And this is affecting lots of people across color lines, but it is disproportionately, meaning more, affecting Black and brown communities. And the thing is, if I don't have access to healthcare, I probably haven't had pre-screening for things like heart disease or diabetes. And so now I'm actually sicker because I'm not getting treatment early. Pre-screening, I get treatment a little bit earlier, right? But if I haven't had money for any of that healthcare because I don't have access to the right things, and I haven't been able to eat healthy to prevent some of this, and I don't have money to go to the doctor, now I am doubly, triply, 6 times as much going to be more susceptible when a massive pandemic hits, right? Also, a lot of these people have no choice, and that should say but to work in the public, right? A lot of people in lower income areas, inner cities, Bronx and New York, right? Orange County, right? Those places like in LA, right? East LA, those things. A lot of people are doing those public service jobs. So because they're doing those public service jobs that are now essential jobs, which just keep note of that. The fact that we think who is essential in this country, and right now we're learning that all of the middle class and lower class people who do the brunt of the work are now these essential workers, and we need to understand that, right? So you've got people who drive a bus and have got to go work in the bus station or have to go work in the grocery store, have to work at the gas station and don't have an option. There is no other option. And then also, I've got to work in that public. So when you say social distancing, I can't because that's the job I have requires me to be a part of the public, which is why it's an essential service, right? So it gets tricky. Also, exposure to conditions that place them in danger. So I can't social distance. I have to take public transportation. I don't have health care, so I can't go to the doctor. I don't have money to buy protective gear. I can't buy all these expensive masks. I can't do all these things that would require me to do that in a situation. I'm not living in a house by myself. I'm living in a complex, apartment building with hundreds of units, right? So I'm going to run into people. I'm going to be up and down in an elevator. Like, all those things start to matter when you're talking about an underlying condition. And so I wish we would start talking about an underlying condition is not just that I'm sick or I have something, but there's things that have caused that, right? And so even the poverty and the racism becomes an underlying condition when we're not addressing that as a country. Now, that's not saying that it's on purpose necessarily, right? Like, we're not trying to increase the death rate, but it is saying that our behavior, which has been on purpose over years, that is causing something, right? And we have to admit that. I'm not going to sugarcoat that for you. And if you are like, no, but there's lots of white people dying too, there is. But disproportionately in the larger cities especially, they're finding this. Now, in LA, the percentage actually of Latino to blacks, there's actually more Latino in the population. Latino population is larger. So because of that, they are actually experiencing a higher rate. So it just depends on the area. But like, I want you to understand when we're talking about who is impacted, it's going to be these areas that are impacted, right? If the prison system is made up mostly of black and Hispanic men because of all this other systematic stuff, then you've got then a higher rate when it hits the prisons, which is starting to become a problem. And they're not talking about that as much yet, but it is becoming a problem in prisons. It's going to become a problem at the border where we're detaining people. It is going to affect the groups that have been discriminated against, that have been separated from access to good paying jobs, access to good health care, access to healthy food. Those are often things that then cause me to have diabetes, heart disease, any of those kind of systems that we think will now make me more open to COVID. Basically here, not everyone can shelter in place. And I have to recognize my privilege in that I have a job that allows me to do this, that I have the ability to take my computer home, that yes, teachers are still the service that we have to have, but there have been some ways I can do it and be safe. That's a privilege. And I know a lot of you have parents who still have to go to work, or have parents who are in the healthcare industry and have to go to work. And because of that, they're serving the public, they're doing those essential services, then they are at risk. And I think we need to, one, honor and respect all those people, the people bagging groceries, the people stocking, the people delivering all the packages, the people doing that grunt work, the people that are out there working at the gas stations to make sure we have it, the guy who's bringing the groceries to Safeway, all the people that are working in fast food right now, all the people that are doing those essential jobs, delivering food, helping people get around, driving the buses, doing the ambulances, all this stuff, cleaning the hospitals. Do you understand how right now cleaning is like the most golden job right now because you are so needed? And I don't mean golden by they're making big money, and that's the crappy part. We're not going to pay these essential people, but we're realizing our society can't operate without these essential people. You don't have those people cleaning right now, we are in so much trouble. Okay, so understand that that's really a privilege if you can shelter in place. If you have family that is working on the front lines in whatever way that means, deepest respect. And I know that's scary. They go to work, they come back, that's intense, it's a fear. And I just cannot thank you enough for those work those essential services are doing. And we're going to have to wake up in America and realize that those essential services, we need to honor those jobs just as much as we honor something in the tech industry or whatever else. And I'm not knocking those jobs. But could we make a livable wage out of this? Could an improvement after this pandemic be that we figured out we needed a livable wage for people? Okay? And that racial disparity in a pandemic, that Black and Latino people are dying at twice the rate of whites in New York City, New Orleans, and other big cities. In LA, it's Latino people dying at a higher rate. The New York City mayor, Mr. de Blasio, now he's different from the governor. The mayor said there are clear inequities, clear disparities in how this disease is affecting the people of our city. The truth is that in so many ways, the negative effects of coronavirus, the pain it's causing, the death it's causing, tracks with other profound healthcare disparities that we have seen for years and decades. It's not new. So whenever you're talking about disease, you're talking about groups that if there is a racial oppression that's happening, then you're going to have more problems that stem from that, on top of the hate. So it doesn't just stop with that one little part. And it has actually been true in other pandemics. African Americans make up, not see this here, but it says 13% right here. 13% of the population, but 43% of HIV/AIDS cases. So if you go to another pandemic of HIV, it's the same. Almost half of the HIV/AIDS cases are in the African American community, but they're only 13% of the population. And those statistics happen, they're true when you're talking about prison, when you're talking about schools that are in poverty, when you're talking about inner city, right? You're talking about how that racial oppression has these systematic effects. It's not like you just say, here's the racism. It goes off into all these different areas when we're acting like that. And pandemics, natural disasters like hurricanes, tornadoes, all that stuff brings that up. It's like you can't put a blanket over that racial hate and disparity when you have something like this that rips the blanket off and goes, okay, look, here's what's really going on. When you don't provide these things, then people get sicker. When you don't provide these things, people can't rebuild their lives after a hurricane, for example. Those things are glaring. And we are going to have to really figure out as a country if we're going to address it this time or not. And I'm hoping that this pandemic is actually bad enough, in a sense, that we wake up. So, what can we do? One, stay home. Always be 6 feet apart when you go anywhere. Wear a covering over your face when you're out in public. Wash your hands and surfaces well, and soap works great, right? Like, I want Lysol. Alcohol is great, but when those products are gone, like I got 2 bottles of this, and when it's gone, then I'm done with that, right? And I can't find it anymore right now. So when that's gone, I just need to remember that soap works great. I just got to scrub and I got to do it, okay? Understand shortages. There's actually reasons why things like toilet paper are not getting to us. And listen to this. And part of it's hoarding. In the beginning, it was hoarding and people panicking. But now I want you to understand something. All the toilet paper we would have used at school, or the toilet paper I would have used at my work and my business, or at my job, or wherever I was working, I use toilet paper there. But now I'm at home, so the toilet paper that I need, all of my need has to come from my house, which means people need more toilet paper if we're all stuck in that house because we're not using toilet paper other places. And so that's caused a mess in the supply line. But the other thing is that the supply lines for like industrial toilet paper like we have at school is different from the toilet paper like Charmin we buy for our house. They're 2 different factory systems. And so the system that makes toilet paper for our schools is going to have to take some time to catch up to help make toilet paper for our regular society. So it's this shift, and it's going to take a while for factories to actually catch up, okay? And then show compassion. There is a film called 3B, and it is on Prime right now if you happen to have Prime. And it is a great film about the first HIV/AIDS ward in San Francisco. And the reason why it's important, I think, right now in the context of this is because it really talks about compassion. And it talks about loving people through that. And so it's a totally different disease, totally different time period. I totally understand that. I'm not trying to make a correlation. But I do think if you happen to have Prime, is a benefit in watching that film right now. And if you remember when I talked about HIV/AIDS, I showed you those big sheets out of that book where they recorded the deaths, and they actually show that book in the film. And there's a doctor in the film, Dr. Paul Volberdine, and he's this bald guy, and I interviewed him in person a while back. And when I interviewed him, the number one thing he said was, "We've fallen asleep," and he goes, "And I'm afraid we're going to wake up and we're going to have a pandemic on our hands all over again, that this thing will just catch fire." And he says, and it'll catch fire in young people because we quit telling the story. And so I think his words have echoed in my head this whole time, because I'm thinking, if we don't tell the story, we don't tell the truth, we don't talk about it, we don't really say what's going on, we're not honest about numbers, then we can't really do anything. And so hopefully this helped make some sense. So your assignment now is to either go write a response to this, at least a half page, or you can join me this afternoon. So look in the link for where on Google Classroom today, when you can join me. I love you guys. I miss you so, so much. So please stay safe. I want to see everybody back in the fall. I want to have tons of hugs and amazing learning in the fall. So please stay safe, okay? Just email me, text me, call me, whatever, if you need something, okay? All right. Love you. Have a good day.